would like to ask your both permission to use this video for educational purpose on the internet.
Sure.
Okay, now, we have been seeing each other for how long now?
2 years.
2 years now. And we have maximized all the non-surgical treatment, and you have significant symptoms, your pain. When it's really bad, how bad can your pain be?
Almost debilitating.
Yeah. Can you give me a number?
I mean, at a certain time, it was probably 8 or 9.
8 or 9. And you know, we looked at your films here, as we see here. You have problem practically from L1 to S1. You have problem everywhere. And as well, look at that. Part of your discs are pushing on the nerve. As well, you look at that. The back of the bones are not aligned. We call that spondylolisthesis. And that spondylolisthesis is mostly pronounced here in 2, 3, 3, 4, and as well to L4, 5. But L5S1 as well L1, 2, they are not innocent. Look at that. They are coming out. They are mushrooming a little. You told me you just, without calling names, telling names, you just came from a different surgeon. What did that surgeon offer you? What did that person tell you? What kind of surgery you need?
Well, her recommendation was that I either needed to have a 5-level fusion due to some issues with the L1 and or L5S1, and her recommendation was that I should maybe have a replacement disc at L3, 4, and then fuse above and below that, thinking that would give more time with the S1 and the L1 disc area.
So practically that surgeon recommended for you to have surgery done from L1 to S1? Is that what your understanding was?
Yeah, pretty much.
Yeah, but that's not what we recommended. What did I recommend to you?
L2 through L4 or 5.
Yeah, and there's no denying that there are problems in other levels there. But the spondylolisthesis, first of all, with the spondylolisthesis, I would be very, very restrictive to talk about the option of the artificial disc. Artificial disc usually doesn't work well if there's significant, instability in the spine, because instability meaning bone moving the wrong way, and yours is with the spondylolisthesis is doing that. Artificial disc usually doesn't prevent the bone moving the wrong way.
Okay.
So that wrong motion continues. Additionally, artificial disc, literally, we have to open your belly, push the organs to the side, and that is can be quite invasive procedure.
Yes.
In many times, add significant amount of, because we have to go through the belly to the complication related to approach.
No.
Obviously, in a good hands that can be done safely. But I don't believe you're a good candidate for that procedure at all because of your spondylolisthesis.
Okay.
As well, I didn't recommend you to fixing all those discs. You remember what
Yes.
I recommended to you?
Yeah, just the 3 levels.
What levels did I recommend you to fix?
L2 through L5.
So not the L1, 2, not L5S1. Do you have a good understanding about why I did not recommend to fix all 5 of them, even though there is a problem there?
Yes, I understand.
Yeah, tell us for the people who listen to that. What did we talk about?
Well, doing one smaller surgery is less invasive than doing multiple.
Yeah.
Or one large surgery.
Yeah.
Or doing a possible revision later.
Yeah, and more or less, it's a risk versus benefit, balancing risk versus benefit. And doing 5-level fusion for you, even though I do it all the time. And I do it with the olive procedure very efficiently. But the risk versus benefit in your situation is not really justified, in my opinion, because of your symptoms. Your symptoms mostly correspond to those 3 levels, including the pain that goes down the leg correspond to this 3 level, and barely any to this level and that level. And yes, the other surgeon explained to you, you may have symptom in the future, right? What did she tell you about the justification or reasoning why you should get those surgery 5S1 and L1 2?
Well, it was more of a comment about chasing a problem down the road.
Yeah, 2 years in a row.
2
or
years,
something.
5 years, 10 years.
And she's right about that. Your risks having problem in the future with other discs is above the average population. I consider that risk to be about 35% more likely than somebody who never had this problem to have problem in the L125S1. But that's a future problem that, in my opinion, should be dealt in the future, not do a prophylactic surgery to what future may or may not bring. Now, having said that, I'm sure that surgeon did not do minimal invasive olive procedure the way I do it. He does a regular open old-fashioned surgery or other method of surgery. And all those 35% more likely having need for other surgeries apply to that kind of surgery where we cut all the muscle and destabilize the spine even more. I haven't published that paper, but all indication pointed that direction by me with the olive procedure preserving of those muscles. That risk might be even much, much lower.
Okay.
So even less reason to do a prophylactic surgery, doing more surgery, in my opinion, than needed.
Yes.
Even though we know there's a problem there. I think that is one of the things that, as I discussed with you, or your body, if it can recover between those smaller surgeries, will recover much faster from two smaller surgeries than from one big surgery. And I truly believe that, you may not even need that consequent surgery. So I stick to my opinion and recommendation that we should just fix those discs, that the bone moving forward and backward, we call that spondylolisthesis.
Okay.
So smallest possible surgery that can give you maximum benefit.
Yeah.
Okay. Any other question?
No.
Okay, thank you.